What's really special about psychedelics is the set and the setting and how the intention and relationship integrating mind, body, and I would even go as far to say soul, really has the potential to create magic. And when we use this kind of vernacular in medicine, the conventional paradigm really is challenged, where we're talking about the magic and the mysticism of the mind and the body. But this is where I find a lot of intrigue, in that our knowledge of medicine continues to evolve over time. And, I question how the future will perceive the way in which we currently treat through medicine.
Hi everyone, welcome to Psychedelic Conversations. Today I have with me Burton Tabaac. Welcome. So good to have you in person here with us.
Thank you for having me. It's a pleasure.
Great to meet you. For our listeners, please tell us a little bit about your background, what you do and what brings you here.
Sure. Well, thank you again for the invitation. I am a practicing clinical neurologist and serve as an associate professor of neurology. And my role in this space is as a scientific advisor for Rose Hill Health, where we have been partnering with Johns Hopkins University on a really exciting clinical project.
Wow. Thank you for sharing. That's exciting. Before we dive into that, can you share with us what brings you to this work?
Yeah. As a doctor, psychedelics have not been mentioned in medical school. So over a 4-year medical school career into residency, I had not been aware of psychedelics as medicines or therapeutics. And it wasn't until my fellowship at Johns Hopkins, where I attended a talk by Dr. Gul Dolan, where my eyes were opened to the potential possibilities. And that really inspired me to learn as much as I could about the work being done in this space, and has led me to now partner with my former program director at Johns Hopkins, Dr. Zeiler, as well as with Dr. Golan.
I interviewed Dr. Zeiler as well. This is so great. I'm so enjoying this connection with all of you. And Dr. Dolan is such a force, right? She's also inspired a lot of my trauma-informed work. Mm-hmm.
Yeah, I think one of the most exciting things is this concept of critical periods and allowing psychedelics to serve almost as a master key to reopen these states of metaplasticity where healing can occur.
Mm-hmm. This is amazing. So can we go into Rose Hill, also I'm connected to them. They're amazing, aren't they? So what's the studies and the research that you guys are doing? Would love to learn more.
Yeah, I'm excited to share that with you. The study is called the Fathom Trial, and there's a couple different elements where I want to lay the groundwork to really understand what we're aiming to do. When a patient has a stroke, there's a neurological injury where patients are left with some degree of deficit, whether it's a language deficit or a motor deficit. And the normal process of healing is that after the stroke, there's 3 months where some recovery can take place, and that's normally where rehabilitation and occupational and physical therapy modalities are implemented. But then patients plateau and they are left with some degree of deficit. And one of the earlier studies at Johns Hopkins showed that when a stroke patient works with an enriched environment and performs non-task-based engagement with play, let's say, then the recovery is more robust than relearning how to use a fork, for example, and compensating. And then that, paired with this concept of psychedelics reopening critical periods, has brought us to a clinical trial design where we're looking to seek and recruit patients that are at least a year out from their stroke injury. And by pairing psilocybin with that enriched environment of non-task-based play, we're looking to rehabilitate and, more importantly, recover, not just compensate that injury, to allow patients to potentially get some of that strength and movement back in the arm that was affected by the stroke beyond that normal recovery window. And this potentially be a paradigm shift in the way in which we treat stroke patients.
Wow, this is life-changing stuff.
Mm-hmm. It really is.
And so what comes to my mind, what are the legal implications? How are you guys navigating this? Like, is it difficult? Surely.
Yeah, I think having psychedelics regulated federally as a Schedule I drug just simply necessitates additional time and work and really passion to overcome those necessary hurdles in order to allow patients access, whereas otherwise it might be more streamlined. Now, interestingly, I think that many would agree this Schedule I designation for psilocybin and psychedelics is really a political one rather than a medical one, as we have learned with plenty of novel safety data that psychedelics do have medicinal value and do not lead to dependence, essentially nullifying or challenging that Schedule I definition. And so from a legal framework, it simply means that for clinicians and scientists to allow work to be pursued, it just requires a lot more time, patience to navigate the FDA and that Schedule I status.
Okay, great. Good to hear. So there's always going to be loopholes and ways to work around to...
I'm really grateful that we have such an incredible team of expertise, where there are those on the Rose Hill team and the Johns Hopkins teams that have the knowledge to pursue the pathways to obtain FDA approval and IRB approval and collaborate together to follow everything according to protocol. And I'm optimistic about where things are heading.
This is beautiful. And I'm very aware that Johns Hopkins been always the leading center, like Dr. late Roland Griffin and everyone that was there. It really is. It's almost like the temple. It's the spiritual temple for our Western world. That's how it feels. Do you agree?
I've always looked up to those academicians and minds that preceded me as being sources of inspiration, as that seminal Roland Griffith's paper that was published in the early 2000s, looking at re-invoking psychedelics, was really a seminal start to reinvigorate this commonly referred to psychedelic renaissance.
Yeah, yeah. Really a defining moment. That's so beautiful. So just coming back to your research, what are your, was there any surprised? Was there any moments of wow moments, surprise? This is such a life-changing study that you are part of. I'm sure it's moved you in many ways to see those results and to see what's possible. Do you have any personal stories with that to share with us?
Thank you. Yeah, so I think first, to be clear, the Fathom trials and clinical work must first proceed through each phase of clinical study. And that would necessitate a phase 1 safety trial initially before proceeding to a phase 2 efficacy. And that phase 1 really has yet to recruit patients. It's still in that initial process of, yes, achieving FDA approval and now going through the IRB, We do anticipate some sort of efficacy signal. However, the data and the results have yet to declare themselves. I think that the way in which the trial was designed is really diligent and well thought out. What's really unique about Doctors Dolan and Zeiler in the way that they approach the design of this study is that there is respect and awareness for the context. It's not simply that psilocybin or psychedelics in general are in isolation promoting motor recovery. It's the specific pairing of the psilocybin with the appropriate context of priming and then motor engagement that we anticipate is really going to be that key to unlocking the potential. And so with that, I would say that that alone to some may serve as a surprising revelation. I think intuitively it makes sense. And as far as personal anecdotes go, what I have been able to see from patients who have been able to pursue pathways through clinical trials or otherwise, just in their own not formally clinically recommended pursuit of psychedelic applications to their own lives. I have benefit and privilege of being able to witness patients' pathways and processes through healing over time with continuity, whether it's a stroke patient or a traumatic brain injury. I think there's also promise with neurodegenerative diseases like dementia and Alzheimer's, Parkinson's disease and movement disorders, and being able to see how they have been able to navigate, whether it's through microdosing or even macrodosing, the potential for healing these otherwise non-psychological pathologies, but true motor and physical impairments, which I don't think has gotten enough spotlight, frankly, in the psychedelic space. We've learned so much about mental health, whether it's anxiety, depression, or addiction, and I feel really excited about this next frontier in the neurological potential.
That's so powerful. Thanks for sharing that. So your perspective, your take on is really valuable, and it almost like takes away the medicalized or medicalization out of it, because we're so used to the medicalized practices. You do something and you eliminate something. This is almost like bringing somehow like the humanity back into it.
I like how you phrase that. Yeah, humanities, in essence, this is art of medicine, right? Where this isn't simply the application of a medicine. I'm going to prescribe a pill for you and you take it. What's really special about psychedelics is the set and the setting and how the intention and relationship integrating mind, body, and I would even go as far to say soul, really has the potential to create magic. And when we use this kind of vernacular in medicine, the conventional paradigm really is challenged, where we're talking about the magic and the mysticism of the mind and the body. But this is where I find a lot of intrigue, in that our knowledge of medicine continues to evolve over time. At one point in time, we felt lobotomies to be the gold standard for mental health treatment. And, I question how the future will perceive the way in which we currently treat through medicine. And I remain really hopeful and excited to see this shift. It also reminds me of this debate in the psychedelic field of those who say or question whether or not the trip or alteration in consciousness from psychedelics can be removed, and if that can still allow healing. And I tend to agree with my advisor, Dr. Dolan, who doesn't think that that's the case, that for critical periods to really open and to maximize this, there is something to be said about that shift in consciousness and the trip and that alteration that along with whatever is happening mechanistically at a cellular level is what is allowing for healing. And bringing it back to the art of medicine, I find that the way in which we are trained as clinicians is almost to dissect medicine and to break down everything into receptors and neurotransmitters. But some of the true essence and the power and potential gets lost if we don't take a moment to also zoom out and think about everything as an amalgamation, as a whole, and thinking about how the healing of not just the medicine, but the relationship with the guide or practitioner who's offering the medicine, the intention beforehand, and what's done afterwards. Integration, of course, that will affect the trajectory and the potential benefit and healing arc where the patient's going to be 3 months, a year out.
Yeah. Wow. This is so beautiful. Thank you, Burton. And so what I want to just kind of offer, like what I'm feeling right now is we have a lot of, in the psychedelic space, we have a lot of friends of ours that take sides, you know, should be a medicalized approach or clinical or spiritual or sacramental or indigenous. And I'm thinking, in the beginning, I know a lot of friends of mine had a pushback to the science of it. But now, if we kind of zoom out and see the whole psychedelic medicines or substances, there is a way in which they can bring us around to the same place, whether from a door, from a science door or other doors. I feel like the early research papers kind of look very sterilized, very medicalized, very sort of structured and contained. And now, this was my, you know, interest from 5 years ago to now. The latest research has come, and the way I look at it is like more of the spirit and the art is coming in. That's what I feel.
Yeah, I agree. And I would add that there ought to be reverence for the history of these powerful plant allies and sacraments that have been around for thousands of years. And I am also aware of the challenges and concerns about commodification of nature. And as long as we continue to respect our partners, as you invoke the indigenous cultures and populations, we must be aware as clinicians to respect that, yes, bringing these medicines out of a ceremonial context into a clinical setting where sometimes the set and setting may be sterilized should be challenged. And that's where we can see institutions like Johns Hopkins invoking music and art and a vibe into the clinical setting where you would not want to offer these medicines in a clinical room with a wax paper on a bed with bright lights. And this is why it really matters that we take heed from our lessons of the past and also recognize that not all patients are going to necessarily respond to and be open to some of these conventional methods. And for me, the most important thing is access. And so to allow multiple different pathways, respect that for one person, laying on a mat in the jungle might not be suitable or desired. And for others, being in a clinical room with someone in a white coat could cause more harm than good. And so as long as we are collaborative, open, willing to receive and engage with one another, to share ideas, I think we'll be maximally positioned for maximal benefit.
I love that. Thank you so much for voicing it.
Yeah, my pleasure.
And then further down the line, I'm sure there will be a time we will not have to speak about this because it will be a natural occurring thing, you know, naturally, authentically, and just the emergence of it.
I agree.
Right. Yeah, we had it that way. Thank you so much for all the work you guys are doing, you doing specifically, and agreeing to speak with us. It's so important to be able to hear from your perspective and your work that you're putting in.
Thank you. I appreciate you saying that. It's been really nice to connect with you today.
Thank you.
And I appreciate the opportunity.
Yeah, and would love to have you back as the research or study progresses. Would love to hear back from you and Dr. Zeiler, and hopefully Dr. Dolan as well.
We graciously accept the invitation.
Thank you.
And we'll look forward to following up as these exciting results declare themselves and we progress forward onwards.
Thank you. All the best. And hope to see you soon. Thank you.
Thank you.
Thank you so much, Burton. Thank you, everyone, for joining us. Again, hope you guys enjoyed this conversation. Be part of the conversation. Don't be shy, and you can connect with Burton or you guys. Is there a way, link, or because I know Dr. Zeiler had a call to action, like if they know someone with like a stroke, had a stroke and struggling, or any kind of information they would like to email, or something like that. Would you like to share?
Sure. Yeah, so the Dolan Lab, DOLEN Lab, offers links to the Fathom Trial, and that's PHATHOM, where they can learn more. If they know someone who's been affected by a stroke, share their contact information and see if they meet the inclusion criteria for trial enrollment. We anticipate that after this exciting phase 1 safety trial, we will be able to proceed on with a multi-site phase 2 trial, where we'll be looking to recruit even more patients. And then even beyond that, the really exciting hope of seeing how these treatment modalities can be offered in a wider context across the country, starting with the states that have allowed for both decriminalization and medical models to treatment.
Beautiful. Thank you so much. And we'll add all of these links and information in the show notes as well.
Thank you. Thank you.
Until next time, thank you very much.
Thank you.
Bye, everyone. See you on the next one.